led you to this specialty?
I'll say my Kundli is written that his profession will involve blood.
And I think it's like the plumbing system of the human body.
If you like, look at my departmental's, the WhatsApp DP. It's a plumber.
Oh, that's so funny. In most of the public opinion, the vascular part, especially, do not get the same attention as the brain or heart.
Yeah. So because
Are you seeing any kind of a pattern towards any particular kind of disease?
we have seen much more rise in arterial as well as venous blockage of disease.
When normally these kind of things happens, like cramps you said, or some pain, we often ignore it.
The most common reason of getting night cramps in evening is
Think about and say that this is why I became vascular surgeon.
most of the surgeons, their biggest fear is bleeding. That is the time we get called.
Vascular surgery evolved a lot, from open surgeries to now
Yeah.
minimalist.
Patients who themselves are 50, 70, 80, 90 years old, the first question normally relatives will ask, Doc, is it safe at this age?
Hey everyone, my name is Nitin Guru and I'm your host at another episode of Medical Value Talks, where we bring valuable medical information right to you. And today we have a pleasure to host Dr. Himanshu Verma, who is Director of Cardiovascular and Endovascular Surgery at Fortis Memorial Research Institute, Gurugram. Dr. Verma comes with 2 decades of deep clinical expertise, and he has worked with various top institutes like Mayo Clinic in USA, Medanta, Paras Healthcare, and now with FMRI. Dr. Verma, it's pleasure to host you at Medical Value Talks.
Hi, thank you for having me here.
It's all pleasure.
So I would like to first thing start. Sorry, I'm interrupting. So actually, I didn't interrupt you initially because that's the one misconception even my father used to have. See, the vascular surgery is not very budding branch in India. It's been there for 25, 30 years, but still recognition of that is very limited. So most of the people will end up going to cardiovascular surgery or so some, as you said, cardiovascular. So it used to be CTVS, cardio, thoracic and vascular surgery. Now there are 3 specialties out of it.
Yeah.
So cardiac surgeon specifically does the surgeries in heart. The thoracic takes care of the rest part of the chest, so lungs and everything. Vascular are the one where the heart is, the arteries and veins are originating from there to everywhere in the body. And then we are trained to do bypasses as well as angioplasty, so both. So
Right.
I am a vascular and endovascular surgeon.
Vascular and endovascular. Thanks for probably correcting
So
me.
as they call in Hindi, nason ke surgeon.
Vascular surgeon. And I think it's like the plumbing system of the human body.
Yes.
Right. So putting in that kind of
If you
reference.
like, look at my departmental's, the WhatsApp DP. It's a plumber.
Oh, that's so funny. But at the same time, I think it's very true, because blood is the main kind of thing which flow across our body, and if it stops, then life stops, of course.
Agree.
And you are helping in that. But before we delve into actually the nitty-gritty of this technique, want to understand what led you to this specialty, and what has been your journey.
So interesting story. So I was when I was in med school, I'm from Kanpur. So
Right.
when I was in not med school, when I was in school,
Right.
so that time in UP board curriculum there used to be dissections. So we used to dissect frog.
Right.
So in my 10th and 12th, I was the one who used to lead the entire class. And I will actually go and inspect everyone. And I actually loved, the cutting part so much that I said, okay, then stitching must have been even better, right? So that's what, so I entered into my med school with clear thought of becoming a surgeon. I was very clear, if I don't become a surgeon, I'm not just going to do MBBS in practice, I'll do something else. So I was very clear. As my journey became, as we joined Masters in Surgery, which is called MS at BHU. Then during my exposure of general surgery, I got exposed to vascular surgery, although there is no vascular surgeon across. One of my mentor, Professor Khanna, used to do some of the vascular surgeries. So it was so amazing to see aorta. and same time different kind of diseases. The patients with chronic wounds. So there were this called wound clinic
Yeah.
in Banaras, where patients will simply come from 200, 300 kilometers just to get the wound dressed,
Right.
because there is nobody else who will
Yeah.
do it. So that time I probably, I'll say more than passion, I actually realized the need of it
Yep.
and the volume. So then I decided, okay, next thing I'm going to do is become a vascular surgeon. And I'm here today.
Amazing story. And something personally also I can relate to my family. One of my aunt had critical limb ischemia,
Okay.
and so I understand the importance of vascular, right, through that, because I have saw her pain and the kind of trauma she has gone through when her toes kind of cut one by one. It was painful to see. And I can understand, like, again, surgeons and specialists like you, how they can help in such kind of.
No. If you believe fate, then I'll say my Kundli, okay, is written that his profession will involve blood.
My God. All right. Amazing.
So my father used to make fun that, okay, if he studies, okay, he will become doctor.
Yeah.
Otherwise, at least he'll go to police or gunda to bani jayega.
That's so funny. But yeah, the faith is something which is nowadays I keep hearing. You come from a clinical background, a deep science kind of background. You're talking about it. We just did an episode with one of the specialist psychologists who was talking about the holistic kind of medicine, including even spirituality aspect of it. So great. I can relate with it. So you already explained what a vascular surgeon does, right? So in simple words, you're trying to kind of enable the vascularity and make sure that it's flowing correctly. Is that correct or something?
Yeah, I'll actually now, as specific the question, I'll actually put slightly more light on it. So see, body has got a system where there's an engine, so heart is pumping it.
Yeah.
Now that blood has to reach to every organ.
Right.
So for this discussion, we have to just keep ourselves away from the heart attack point of view.
Right.
Just take it the same way that if attack can happen in heart, it can happen in any part of the body.
Right.
Heart attack is essentially heart is not getting sufficient blood.
Blood.
Similarly, brain attack, what we call the stroke, most of time is brain not getting sufficient. Same thing can happen in any part of the body's blood supply.
Right.
Now, for that, we have to understand blood supply happens through the channel, the main blood vessel, which divides into branches. Branches goes to your abdomen, to your liver, pancreas, kidneys, eventually go down to both legs.
Right.
Now, the disease, which is called actually atherosclerosis, in simple language, if we say deposition of the calcium and cholesterol, it's a global disease. It's not only disease of heart. So, if it happens, say, in any organ like leg or anywhere, that organ malfunctions. Like you said, your aunt, she had a critical limb ischemia, pain in the legs. So, as a vascular surgeon, we have been trained to treat all these kind of blockages. And to be honest, there are multiple kind of diseases either by medicines. Okay, so not everyone needs a bypass or stenting. Those who are fit, we do bypass. Those who are not fit and sometimes required, we do angioplasties also. So, as a branch of and same time, there's a blood comes back also. So, when oxygen is used, the rest of the blood comes back to the heart via veins.
Right.
So, then there are different kind of veins disease that can happen. So, we are a plumber who have blood flowing in the tubes, and depending on need, we fix it.
Wonderful, sir. But at the same time, see, I'm also discovering this as you say the first time. But why is it that in most of the public opinion, the vascular part, especially, do not get the same attention as the brain or heart?
Yeah. So because if you look at the overall spectrum, kind of symptoms patient have, either sometimes they are quality of life issues. So if say women having pain, so most of them say, okay, by the end of the day, legs will pain, and they get pressed by somebody or mild massage. They say it's okay. It's not okay. It's part of varicose vein, leg swelling. So lot of this is about quality of life issues. So for that there has to be certain level of understanding, and then there is a lot of I'll simply say lack of knowledge. So people know that in diabetes, the wound will not heal in the feet. It's very common. Okay, everybody's, but
Right.
why it does not happen? 60 to 70% of the patients who have wound which is not healing will actually have blood vessels blocked.
Right.
And simply by doing dressing at that area is not going to help unless you improve the blood flow.
Right.
Now, that knowledge is also not come because most of time providers have not been there. If you look at the distribution of vascular surgeon in India, north versus south is more than, say 5% versus 95%.
My God.
So most of them are in south and very less are in north. So that's also one of the reason.
Right. And talking about especially vascular kind of diseases, yeah, there is diabetic foot. Again, there are varicose kind of situation. What are the most common diseases you are seeing nowadays?
So there are, as a vascular surgeon, there are two kind of diseases.
Okay.
One, patients who directly come to us.
Right.
And second, which are being seen by some specialist doctor, say specialist of kidney, specialist of intestine. And if that particular blood vessel is blocked,
Yeah.
then that doctor, they consult us. Or for
Alright.
example, sometimes there's a cancer surgery.
Right.
The cancer is sitting at a very vital area where blood vessels are going. Now, if they have to resect that cancer out, they require us so that when they resect it, we can actually repair it again.
Repair it. Right.
So that's one. Second, if we say those who come directly to us now with better and better knowledge, the gangrene patients, the blood vessel blockages patient who come with either leg pain or gangrene or non-healing ulcer. So any kind of chronic leg problems, leg swelling, leg pain, discoloration. So that's one of major chunk. Then you see the varicose veins, so prominent veins of the leg, even cosmetics sometimes. So those are the comes. Then if I start from top to bottom, so every organ, so like in neck you have certain situations, there are certain causes of stroke, those are treated by surgeries. Then if you look at hands, so a lot of time patients have a cervical rib which causes pressures in hand. So I'll say it's not very really possible for everybody to understand the gamut of vascular surgery.
Right.
I'll be happy at least if doctors understand it.
Absolutely. But yeah, are you seeing any kind of a pattern towards any particular kind of disease?
So we have seen much more rise in arterial as well as venous blockage of diseases. Arterial, I'll say about the atherosclerosis, because a lot of this is also a lifestyle problem.
Right.
So the blood vessel blockage, especially post-COVID, see what has happened that in general our mobility has gone down.
Right.
A lot of us have become used to at least partial kind of work from home scenario. When we sit in home, we are sitting in AC, we don't move much. So veins, the blood flow happens because mainly when we walk, our calf muscles pump.
Right.
So we have seen surge of venous thrombosis also. So a lot of young patients we get, simply they're dehydrated, they don't drink water, they are not inside, they are just inside house. And then then the diet habits have changed. So we've seen a lot of rise in vascular diseases, both arterial and venous.
All right. So you are actually directly saying that sitting long hours, and especially professions like us, the tech ones, which is mostly in mobile, I think it's leading to such kind of.
We actually, there's been the emerging concept of standing desk and keep on moving. That's one of the, simply they are directly related to the vascular health.
But at the same time, many times what happens if you stand long, you feel bit of numbness, right?
So standing long is not a solution. You have to keep walking away. Okay.
Right.
So as I said, when you walk, your calf muscles pump. Okay. That pump is what sends blood against the gravity.
Right.
But if you simply stand, if you don't walk,
yeah.
Okay, then what happens? That leads to the stagnation of blood in your calf. We have security guards, nurses, all long-standing jobs. Being a housewife, somebody, okay, it's a full-time standing job. So then by the end of the day, your legs are drained, they're full of blood, pain, night cramps, that all can happen.
But at the same time, like when normally these kind of things happens, like cramps you said, or some pain, we often ignore it. when do you suggest like someone should actually start taking notice of it and maybe probably consult with a vascular surgeon or a
Agree.
doctor?
So I wouldn't want after watching this that everybody, tomorrow they have an appointment lined up. No. See, the most common reason of getting night cramps in evening is subtle dehydration. Okay. If you don't, so your legs are actually water tank of your body. If you don't drink enough water, they will store some extra blood in here, and that will cause night cramps. First thing to do is actually maintain good hydration. So maintaining water sufficient enough so that your urine color is clear. That's a bare minimum marker. It may be 2 liters, it may be 3 liters, but that much of water has to be drunk. What I have learned in my clinical practice, that most of the people drink less water than what they think they actually are drinking. So if you think you have been drinking 2 liters, probably if you go and count, it will be 1 liter, not more than that.
I got. Yeah, probably true, and with me as well.
And then beyond that, if you're maintaining, you have a good lifestyle, you have been walking enough recently,
Right.
still you get pain which almost affects your lifestyle. That is what term I say, that
Yeah.
in evening you actually feel need of some help.
Right.
Then you should consult somebody once.
I see. And so I understand that you have performed so many surgery. I have read that you have performed more than 5,000 fissure, right, surgeries. And so all these surgeries, do you have any kind of experience which you can, think about and say that this is why I became vascular surgeon?
Yes. So one of my friend actually, he said long back that cardiac surgery is like chess. So there are very set rules. You cannot deviate, because it's a very small organ and anatomy is very precise, and there are very set rules. Whereas vascular surgery is like being an artist, because you are being given pipes which God has made, and if something is damaged, then in what most creative way you can actually go and maybe realign the same thing, or make a new tube. Sometimes you go on the same path, and then you also get like what cardiologists they do inside heart and what a cardiac surgeon do inside heart. Collectively, all those things, so we do open as well as endovascular. All those things we get to do in the whole body.
So it's like big chess, not a
Yeah.
small chess.
And what happens that most of the surgeons, their biggest fear is bleeding. Okay, during surgery there is a bleeding. Most of them.
Yeah.
And that is the time we get called. So in entire hospital system, you might be the youngest one, but sometimes the biggest guy actually call you, and you will be the person saving them. So yeah, it's a good thrill.
Yeah, absolutely. And especially on the fissure surgery, because that has been your core expertise. Can you tell about what, of course, like, help kidney patients explain what this is and how important this treatment is?
Excuse me. So see, AV fistula is something which was not my primary interest.
Okay.
When I actually passed in, or whenever a vascular surgery trainee is getting trained, it's one of those small kind of surgeries which you do it, that kind of perspective. But when I came into practice, and what actually helped me to establish myself, that certain facts, the patients who require dialysis, that load is humongous. It's increasing day by day. The other option, transplant, is hardly available to say like not even 5% of the people. So those 95 patients, for their lifetime, they depend on having a AV fistula. It's a small surgery where you connect an artery and vein, you manually stitch it. When the high flow in vein becomes bigger and vein becomes swollen up, then you can actually put 2 needles from outside. From one, the blood goes into dialysis machine, and the second one, the clean blood is returned to your body. Now, because God has not made veins for this, so there are a lot of things can go wrong. So, and for a dialysis patients, this fistula is their lifeline. Now, because vascular surgeons are not everywhere, so we get patients who have 1, 2, 5, 10 failed fistula surgeries. And after that, they are either left to die, or if they come to us and then we have been able to provide them solution. That's why over a period of last over 10 years, that area, gradually we started feeling joy of it.
Right.
So, gradually became a love of my life.
And you're talking about the evolution. So on the similar line, I think vascular surgery evolved a lot from open surgeries to now
Yep.
minimalist, right? How this has improved the patient experience? Could you please dwell something on?
So so vascular surgery is, as you rightly said, the gold standard still a lot of time is a open surgery. That means if it is blocked, then you actually take another conduit, you take a vein from somewhere, and you connect proximal to distally. But then as things have evolved, they have led to, the best thing is that these diseases, most of them are diseases of elderly. So nobody will usually develop blockages when they are very young. So patients who themselves are 50, 60, 70, 80, 90 years old, the first question normally relatives will ask, Doc, is it safe at this age? So I tell them, we have evolved to make this safe at this age only. So say at 90 years of age, you don't want to put cuts. You just want their pain to go down. And if that can be done without giving anesthesia, so you can just under local anesthesia, you can perform the surgery. Or say suppose patient has got aortic aneurysm, there's a risk of rupture. If ruptures, it dies immediately. Now if you can fix that, just with a small puncture and local anesthesia, and patient can get discharged on next day.
Right.
That is a big relief to the family as to the patient itself.
Right.
I'll actually tell you a small story that tells the evolution of vascular surgery. So there's a disease called aortic aneurysm. It's essentially ballooning of the blood vessel in your abdomen, and just like balloon, if you pump it more, it will rupture. So if aneurysm becomes bigger than certain size, it will rupture and patient will die. If you look at 18th century, standard treatment used to be, the moment that balloon will rupture, they will open abdomen and ligate it.
Right.
That will save the patient's life, but both legs will die. So then both legs used to be cut from the hip, and patient used to literally become beanbag. Now as it evolved, Albert Einstein had the aortic aneurysm.
Oh.
That time they did not had technology to correct it, but they had somewhat idea. So Einstein was operated twice, and they had a cellophane sheet, what we know.
Yeah.
So a cellophane sheet was wrapped around the aneurysm, so that in hope that when it will heal, it will cause scarring. Okay.
Right.
And these all surgeries require the full abdomen to be cut.
Yeah.
He survived 7 years on that.
Wow.
Cutting to post 1959, 60 around, when Professor Michael A. DeBakey, he stitched actually one of the first graft on his wife's sewing machine.
My God.
And then he developed and he implanted that, and he developed the first bypass. So that's why when the bypasses started happening, cut to cut now, but still everything will evolve, cutting the big cut. And now we have the same technology can be done under local anesthesia with 2 punctures here. The same surgery and patient can walk same day or next day. So that is the evolution of vascular surgery.
It seems like evolution of like cars. So earlier, you need to have those GM Motors old cars, and now you have like latest electronic vehicles, EVs in the market. So amazing. Like technology has evolved a lot.
As I say, everything, but people have to understand everything comes at a cost. So you cannot generalize the cost. So
Right.
It's important to have.
But comfort is also there, and you especially talked about local anesthesia. Can you help our audience understand what is local anesthesia and how it actually benefit or ease out the patient?
I'll start with this funny story. So basically, local anesthesia is something where you inject. Say, suppose I have to work somewhere in heart, but I inject something so that this area becomes numb. Body, you only have pain on the surface. Inside, there is no pain as such. So when we inject, we open that area and then we pass wires across and we go inside. That is what we operate under local anesthesia. With the advanced technologies, if I can insert those safely without much of pain, and then we can work on live X-rays, that is what gives a leverage of doing it. There's one patient I was talking, and I said, okay, we'll do under local anesthesia, and please prepare it. Patient literally got paranoid, and he was lying down. He said, sir, we'll pay you more. Please don't use any local thing.
Use global.
Use something which is of standard.
That's very funny. Yeah, I mean, some terms are very ambiguous that it leads you to believe. Yeah, but that's why I asked you to please help our audience understand.
So the advantage of local anesthesia, if you can safely, whenever we estimate risk of any surgery.
Right.
We estimate risk of surgery itself and risk of giving anesthesia as well.
Right.
Because most of the time is general anesthesia. That is also, it's also evolved, but
Right.
still, somebody who's got a poor heart and then you take them on ventilator, operate,
Yeah.
keep in ICU, that becomes an added disadvantage.
Absolutely.
So if you can operate something without giving them anesthesia, just by numbing this local area, that improves outcomes a lot.
Absolutely. And for patient also, he is fully aware, right, of what is happening with him. So I think it makes him
That
comfortable.
sometimes actually bites back
Okay,
because
okay.
patient's scared and then so a lot of counseling goes into that.
Yeah,
So
right.
every surgeon who is doing under local anesthesia, they have to understand, they have to spend enough time to the patient, telling them that what room they are going to go in,
Right.
what is going to happen. Because I've seen a lot of time doctors, they, okay, this will happen, but they don't explain. They have to actually explain them what is the process going on to them. Because when you operate under local anesthesia, that is also one of your equal responsibilities.
Absolutely. I think you touched a very important point in terms of patient interaction. Having that kind of empathy always help. I remember I went through a kind of a condition where the first time I met with the doctor, the first thing he said, "You will be all right, my child," and that kind of relieved me. Like 50%, it cured. Right? He said he's saying that I would be all right. Then I don't need to worry about it any longer. So I think that's very well point you have highlighted, and I'm sure that's why you had so many successful surgeries where you established that kind of connection with your patient. So moving along, sir, your experience had been both in India as well as overseas in US. What do you see as a difference in terms of whether it's a use of technology or patient care? Uh, have Are we still catching up or already kind of moved ahead?
There's a reason I've come back from US despite being offered, you know, long story, despite being having opportunity to work over there. We are a much more cost-effective effective system, despite working in a 7-star facility in India. But still, we are much more cost-efficient. The kind of burden we have to deal with, and I think at some point we need to still evolve in terms of right amount of documentation and what we call as a clinical research. Because if we are able to show the world what we are doing, and maybe do slight changes in our practicing of documentation, we are one of the best one in the world.
Wonderful.
Yeah, see, those technological advances which sounds very flashy in certain Instagram reel are only required for say 0.0001% patients. What we need to make is the system which 90% patients are going to require, it should work fine. That's it.
It's just great, like we are already there probably, and maybe moved ahead in some of the kind of cases, because cost efficiency is there. When the cost efficiency is there, maybe the post treatment can be taken on, and then that becomes an important part in the recovery.
See, sorry, I'll interrupt. Because there are two Indias. Okay, if you generalize it, it's not going to work. There are two Indias, and there's a need of reference.
Correct.
There's an India which needs a basic healthcare facility. Okay,
Right.
so you need a basic facility to be able to give in birth. You need a basic facility where babies can be kept alive. But there's also there's India which demands the best treatment of the world, and they don't have any financial constraint. You cannot make one facility where both can be treated. Sorry, you cannot. Okay, because unless government says okay, everything is free and we are going to give money to the patients as well as doctor, it's not going to work. So we have to understand these two different kind of facilities exist, and both are doing amazing.
Right.
I have friends in AIMS or say BHU. If you look at the kind of work they are doing, it is way better than any government hospitals they cannot imagine outside. And same thing goes to private hospitals. Look at the technology they have. Most of them, they have technology on par with any of the international places.
Wonderful. And yeah, I mean, we have JCI hospitals in India. Fortis is JCI, and multiple others. So I'm sure that we will be the top medical hub of the world pretty soon.
Hopefully.
And now moving on the vascular, again on the subject. what I've heard so far is that a lot of old people only get this kind of a problem. Is it a myth, or it's like reality that yes, mostly old people get, not young people, get this kind of complications?
So now our definition of aging is changing.
Yeah.
So there was a time when 70s and above used to be called old.
Right.
Okay, now came 60. Now the similar pattern which you are seeing in heart attacks. Okay, so it's majority of time it's the same disease, atherosclerosis, and those who have got poor heart, they already have the. It's not only happening in heart; it's happening everywhere else. So number one, it's not happen. It's not a disease of old. It's disease of middle age and old. That's
Right.
first one to stand.
Yeah.
And it becomes suddenly very important because in our Indian society, most of the time, the middle aged person of the family is the person who supports the entire family. So it's understanding the vascular diseases and the health. It's very important because if something happens to him,
Yeah.
then entire family gets crippled. So
Absolutely.
we get a diabetic. So screened for your vascular status. If you're a diabetic, if you're a smoker, if you have a hypertension, if you're a known heart disease, very important. Same time, the treating your varicose vein if they are symptomatic, if indicated, that's also very important. Uh, Not getting misguided and getting unnecessary laser treatment for varicose vein is also very important to understand and read. So yeah, it's a problem at both ends.
And are there kind of a general checkups or tests which people should do every 6 months or so, or do you recommend that no, only with consulting with a specialist?
Yeah, so normally we say that not, so 6 months is not, most of the places in the world there is no screening test or
Yeah.
something which is done every 6 months.
Right.
Okay, normally most of the corporate hospitals, the concept of preventive checkups is still not there in rural
Right.
India or
Yeah.
in government this thing, but
Setting. Yeah.
most of the private hospitals they have, and some of them have started including. There's something called ABI, ankle brachial index, which checks the gradient of blood pressure in hand and legs and gives you some idea whether person has some diseases in legs or not.
Yeah.
Similarly, a basic ultrasound scan of your groin and abdomen can actually check whether somebody has got aortic aneurysm screening or varicose vein early. They're not part of routine guidelines yet, but yeah, they're evolving. Uh, Most of time, so again, vascular surgical diseases, it's very vast term.
Right.
Okay.
Yeah.
So either your doctor will recommend.
Mm-hmm.
So if your doctor recommends, please go and meet a vascular surgeon because that recommendation is already made.
Right.
Or others ones like diabetics and all, you should get one screening done and then if required SOS basis.
And sir, now we are moving to the kind of a final session, and want to understand. You have been part of more than 40 publications, I said, right? And what is the kind of upcoming breakthrough or innovation which is happening in your area of specialty, which you can share with the audience?
So actually surgery has been ever evolving branch, especially the endovascular. Now with advent of AI, there's even the rate of evolution has even increased. So if I divide the segments of innovation in last decade has are become hugely in terms of imaging. So for 20-30 years there's only one thing, angiogram. Now there are a lot of imaging have evolved.
Right.
So latest one is the evolved from 2D imaging to 3D imaging, angiogram. Then we have gone to IVUS, intravascular ultrasound. We have been doing very regularly. So there's a very small wire, and the ultrasound probe you have seen. There is a small wire, and on tip of that there's a micro, the ultrasound probe,
Wow.
which goes inside blood vessel, and it can look at those blood vessel from inside.
Wow.
Okay. Now there is many more in terms of imaging, and then there are other supporting therapeutic So if a blockage, you go, you pass a balloon, you put in a stent and come out. But what if there's a calcium is a lot?
Right.
So there's a lot of supporting systems are developing. So there used to be therapy called lithotripsy, where you will break the kidney stones. Now we have incorporated that again over a small balloon.
Wow.
So you go inside balloon, and then that lithotripsy, it breaks the calcium.
Wow.
So there's a lot of innovation going on happening, and yeah, so vascular surgery is exciting.
Wonderful. And you have been doing it for 2 decades. What is like one life lesson which you can share? Uh, maybe it has taught you and evolved you as a person, which you can share today.
That's a tough one. I think I will take pause in this maximum because
Sure.
if we say, I'll give you example of one of the kind of disease, because generalizing vascular surgery is very difficult. So you learn a lot when you start meeting patients. So what you have learned in your medical colleges, and you might have been gold medalist, and you might have just knew everything in the book. When you come and out in open practice, you understand going by the book is extremely difficult thing, and sometimes it is not the right thing. By passing out that MCH or DM exam, you have just probably learned less than half of your medical journey. Your next few years and your real teachers, which are the patients, and those interactions are going to teach you everything. And most of the part which you will be at the end of 1 decade. You have to learn that one treatment does not fit for all. There will be patients who cannot pay that much. There will be patients who are not actually, the candidate for that therapy. In 10 years, therapy may actually evolve. You have to go back and read and adapt the newer technology. So there's going to be a lot of variation. But as long as you spend time with your patients, not only operating, talking to them when they come to your clinic first time, talking and interacting with them in your follow-ups, that is what you'll learn everything. If you keep this as a one anchor, everything else will fall around.
Wonderful, sir. And finally, on for the same similar kind of maybe one gentle reminder or daily routine reminder for our audience who are listening to this discussion, how they can take care of their veins and arteries and make sure that they don't develop any kind of issues.
God has made your body to lift up yourself and carry on. So I often ask my patient, how much weight you can lift? Somebody said 5 kgs, 10 kgs. Okay, please get up and sit here. They get up and sit down. Okay, so God has at least asked you to lift this much of weight using all possible muscles and move around. So staying active is the basic exercise you can do.
Wonderful.
So, no more sitting long, get up, walk around. So
Right.
make sure what target is roughly 10,000
Yeah.
steps, at least you achieve say 8-9,000 steps per day.
Right.
Realize your changes that are happening in your environment.
Right.
So we sit in AC, air is not good. So we don't feel thirsty.
Right.
So that concept of drinking water when you require is not actually right, because your body doesn't feel thirsty. So you have to make sure that you drink 2 to 3 liters of water per day, unless medically contraindicated. One of the best markers is urine output is good. Urine is clear color.
Right.
And then lot of other things which have been told are bad are bad. Okay, and last and the most important thing, importance of screening. So if your sugars have been around 130, 135, don't just close your eyes. Go get it. Do actively look for your risk factors and control them before they turn into a disease.
Great. I think really profound kind of tips, and I'm sure the audience will, be reminded that these are the kind of things which they can follow, and it's very easy, right? Having mobility in your life and having proper water intake, something which even I
Yeah,
think
I
I
mean,
will
believe me,
remember.
people come to me paying my consultation fees. So sometimes only thing written on their consultation is drink 3 liters of water per day. Come back after 2 weeks, pay this much money again.
To be reminded. Wonderful, sir. So I think it's highly valuable kind of inputs. Thanks for that. And finally, this is medical value talks, right? And just wanted to gain your feedback. How was the
No,
experience?
thank you. Thanks a lot. Actually, we need lot of these now, because we spend a lot of time on social media, on YouTube. Myself, I'm a avid binge, YouTube watcher. But unless good content is there, unless a lot of time we say that, okay, people watch this Baba, they follow this, and there are so much of misinformation.
Right.
And a lot of time we sit back and we criticize that. But it's our responsibility to come back and actually provide the right material,
Right.
so that people can actually watch that. So thank you.
Wonderful. No, thanks so much for that feedback, and it actually encourages us to keep continue and keep doing the work which we are doing. Again, it was lovely to host you, and we
Thank you.
would love to invite you again in our future episodes. Thanks a lot, Dr. Verma.
Thank you. Thank you.